Type 2 diabetes. Traditionally, it's categorized as a chronic and progressive disease that's managed over a patient's lifetime through various treatments, including prescription drugs like insulin. Once you contract type 2 diabetes, it's a disease that stays with you for life. But what if we don't think traditionally? What if we wanted to eliminate this disease from a patient's life? What if we wanted to reverse the disease? According to the U.S. National Center for Health Statistics, a chronic disease generally cannot be prevented by vaccines or cured by medication, nor do they just disappear on their own. To treat these chronic diseases, doctors refer to federal guidelines created by associations like the USDA and NHS, which outline protocols for outpatient care and prescriptions. But how effective are these guidelines?
All these diseases in modern society that we treat today, we refer to them as chronic diseases, ultimately caused by these federal guidelines. And unfortunately, these guidelines are causing the diseases that we were trying to prevent in the first place.
While some physicians like Dr. Gerber would like to think outside the box by viewing diabetes as simply a reversible disorder, major U.S. media outlets reinforce the views of federal guidelines.
Diabetes is a growing epidemic,
and the condition is incredibly widespread.
Diabetes can certainly shorten your life if we don't manage it well.
Well, a big problem with how we see type 2 diabetes, both from a media perspective and from a physician and healthcare perspective, is that a number of people still portray type 2 diabetes as a chronic progressive disease. A New York Times article that came out saying exactly that, talking about how we cannot treat this disease and we have to manage it. And unfortunately, the medications are becoming more expensive to manage type 2 diabetes.
Federal guidelines aren't working, and in the meantime, diabetes is progressing in patients. Do we simply ignore the guidelines then?
Diabetes is a chronic disease, and it's going to continue to get worse if you follow the guidelines. The guidelines, sadly, put out by associations that are supposed to be advocates for people with diabetes. Okay, so if we want to solve the problem, we have to take away the cause.
But before we can determine the best treatment for diabetes, we need to zero in on its core cause. How do we treat the disease instead of just the symptoms?
If you're a type 2 diabetic, it's a dietary disease. It's a disease of essentially too much sugar. So if you understand it like that, then the answer is to get that sugar out, get it down.
Imagine that your body is like a sugar bowl. Over the years, consuming foods high in sugars like sweets, soft drinks, carbohydrates, and more contribute to that bowl of sugar filling up. When you consume too much sugar in your diet for a consistent period, that bowl becomes completely full. There isn't any more room for additional sugar, so when you continue eating it, it spills out into the bloodstream.
So when diabetics remove at least a lot of the carbohydrates from their diet, their blood sugars goes down, and then they're not diabetic any longer.
One of the most popular ways to treat patients once their metaphorical sugar bowls spill over is for doctors to prescribe insulin. Unfortunately, the body begins to develop a tolerance to the drug.
The drugs don't actually do anything for the disease. And this is also not controversial because the thing is that type 2 diabetes is a disease of too much insulin resistance. So the treatments that we give are all targeted at blood sugar.
What Dr. Fung is saying is that we're currently too focused on treating symptoms. If we look back at our sugar bowl metaphor, we should be thinking about how we can reduce the overall level of sugar still in the bowl so it doesn't keep spilling over. But how do we do that if traditional medical treatments like insulin aren't the complete answer? According to Dr. Elliot Joslin, one way could be a solution that has existed for nearly 100 years: fasting. His study on the subject was published in the Canadian Medical Journal, where he was quoted as saying that temporary periods of undernutrition are helpful in the treatment of diabetes will probably be acknowledged by all after these 2 years of experience of fasting. It seems patients are already acknowledging the effects of fasting.
They come back and they think, I thought I'd be miserable during this whole thing. And they come back and they say, I feel terrific. My weight is down, I'm taking so much less insulin, I'm off of a lot of drugs, and I have so much energy, and my mind is more clear, I've lost that bloated feeling.
Of course, fasting isn't the solution for everyone. Instead of a complete abstinence from food, some patients respond better to adopting a low-carb lifestyle. The positive effects of this new lifestyle change can even be felt by patients early on in the process.
Initially, when patients are beginning a lifestyle change and shifting to low carbohydrate to help their diabetes, it is so fantastic that within the first few days to couple weeks, we can entirely remove a medication.
And it goes beyond deprescribing medication. A low-carb lifestyle is a proven long-term treatment for type 2 diabetes.
There is quite a big evidence base for low carbohydrate, even in type 2 diabetes. So yes, it's evidence-based.
Dr. Hallberg has been observing the results of low-carb diets for patients with diabetes firsthand. For 2 years, she led a study at Indiana University Health that demonstrated a reversal in diabetes progression. The study showed a 62% reduction in patients' insulin use and 100% reduction in the use of sulfonylureas.
What we were seeing in the patients with type 2 diabetes was nothing short of remarkable. I mean, we were getting them off of medications, we were seeing normal A1Cs. I just couldn't believe it.
At the end of 2 years, 53.5% of the participants who adopted a low-carb diet as part of the study maintained diabetes reversal. Meanwhile, for those patients who undertook usual care, 0% maintained diabetes reversal, demonstrating that low carb is an incredibly effective long-term treatment for type 2 diabetes.
This can't be good for people in the long term, you know, what's happening long term for patients. But again, in my clinic, I have people who've been doing this for years. And, you know, the complication is they have to get used to feeling better. People find that to be pretty easy. We don't see these big complications coming up. People do incredibly well eating this way.
As our understanding of the disease of diabetes continues to improve, and we focus on treating the core causes rather than the symptoms, our ability to improve patients' lives increases drastically.
People with type 2 diabetes should have hope that this is absolutely a reversible condition. If you're following the right nutritional and lifestyle advice and you're getting appropriate support and guidance as you go, yes, you absolutely can reverse this disease.